Hello everybody, and you're all very welcome to the virtual library. My name is Megan and this is my colleague Rachel. We are two community pharmacists and you're catching us today outside the dispensary. So instead of dispensing medications, we're dispensing ideas around allergies. So we're going to be talking today about managing and resolving allergies. And we're going to dig into what allergies are, some common causes, signs and symptoms ranging from mild to severe. We're going to look at how to diagnose or check for allergies, how to treat them, and prevention, which revolves around identifying the allergen first of all and then avoiding it. So in the simplest form, an allergy is a reaction that the body has to a particular food or substance. And I just want to take this opportunity to distinguish between a few terms that are used in relation to this category. So we've got allergy, sensitivities, intolerances. So an allergy specifically is where the body's immune system produces a reaction. So it's an immune response, and this is when we're exposed to a normally harmless substance. So something that could be provoking an allergy in you would be harmless to the next person. So antibodies are formed, particularly IgE, and re-exposure then the body has produces a reaction. So that's an allergy, so the immune system is very much involved. And then going on to sensitivity, this is kind of more of a broad term, but it's basically an exaggeration of the normal effects of the substance. For example, caffeine, in large quantities, or for people who are sensitive to it, it can cause things like heart palpitations or trembling, that type of thing. So this isn't an allergy per se. There's no immune system involvement. It's more just a sensitivity to the actual causes of the ingredient. So then we have intolerances. Again, this is not due to the immune system, and this specifically is more to do with a difficulty digesting. A common example would be lactose intolerance. So lactose is, as we know, is a simple sugar found in dairy products and other foods. And lactose intolerance is whether we either lack the enzyme to digest the lactose or it's not working very well. We have some of the enzyme, it's just not working as well as we like. So eating foods containing high quantities of this lead to stomach upset, digestive system discomfort, bloating, etc. But the symptoms are localized to the gastrointestinal system. It doesn't involve immune system or other systems. And the intolerance can be related to the quantity of the food. So for lactose intolerance, some people might be able to eat, a small piece of cheese, but a glass of milk would cause an intolerant reaction. So, so that's lactose intolerance versus dairy allergy. That's where the immune system is involved, and multiple systems can be involved. So the gastrointestinal system, stomach, the skin, airways, and that type of thing. So it's a bit more broad reaction. So intolerances as well can change over time. If you have a stomach infection or stomach flu, you mightn't be able to digest certain foods all that well until they heal. This is more temporary intolerances. Some are quantity related. So an amount of food causes the reaction. And some intolerances are long-term, so they don't kind of go away over time. So back to allergy then, which is the main focus for today. So the immune system is producing a reaction, and the substance is normally harmless, but if you are allergic to it like that, the immune system for some reason starts to attack this substance and produce antibodies to get rid of it. And histamine is released from mast cells. So you might have heard of histamine in terms of an antihistamine, which works against that to prevent a reaction. So the histamine results in localized inflammation, swelling, itchiness, redness, that type of thing. So substances that cause allergic reactions are called allergens, and common ones include grass and tree pollen. We have things like molds that produce spores. Mold spores can be allergic. Dust mites, animal dander, foods. This is a very common one, especially things like nuts, shellfish, some fruits, some eggs, cow's milk, sesame, that type of thing. These are very common in children, and some of them, some children will outgrow these, particularly ones like milk and egg allergies, but some are lifelong or long-term. Other allergens can be insect bites and stings, latex, household chemicals like hair dye, detergents, and certain medicines as well, including common ones like ibuprofen, which would be in the likes of your over-the-counter Nurofens, Prupro, that type of thing, aspirin, and some antibiotics, particularly penicillin. So it's really important, obviously, if you have a history of allergic reaction, to communicate that with everybody, your doctor, your pharmacist, especially if you're receiving medications or buying products in the pharmacy. So allergies, like I mentioned, they're particularly common in children. Some of them can go away as they get older, and some are lifelong. And while they can be a nuisance, a lot of them, especially if they're mild, they can be managed very well, and your quality of life can be normal. So the other thing I want to say is that the allergies in general are very common in Europe. 1 in 4 people are affected, so probably likely that you or someone you know has experienced allergy at some point. So that's an overview of what allergy, intolerance, and sensitivity is, and some common allergens. So next, Rachel is going to talk us through the signs and symptoms ranging from mild to severe reactions.
Thank you, Megan. So I'll start with the most severe reaction, the most severe allergic reaction, which is anaphylaxis. So this is something that is life-threatening, and it's basically the body's reaction to cytokines and inflammatory mediators that the body releases when they are introduced to the allergen. So it can be caused by many triggers. It can be caused by foods, especially I suppose one that people will be very familiar with is nuts, and medicines like penicillin, ibuprofen, and bee stings. And it usually comes on very quickly, and usually it comes on and then it goes once it's treated properly. But occasionally, even when it is treated and when you're okay again, it can actually come back, usually up to about 8 hours later, but even in some people up to 72 hours later. So I'm going to be talking about the treatment of anaphylaxis in a while, but we'll just talk about the importance of having treatment then, and also making sure that you have treatment in case this biphasic reaction occurs later. So the many organs in the body are affected by anaphylaxis. Symptoms include swelling of the throat and mouth, difficulty breathing, lightheadedness, confusion, and then eventually, if it's not treated in time, lack of consciousness and possibly death. It is a medical emergency. It's really important that an ambulance is contacted immediately, and that you use the word anaphylaxis when you are talking to whoever is on the other end of the line, so that they understand that there is a life-threatening allergic reaction happening. And they should come and give appropriate treatment. And we'll talk about the treatment of this in a while when I go on to treatment. And if you're ever in doubt as to whether or not they're having the anaphylaxis occurring or not, always give the treatment anyway. Give the adrenaline treatment if you're in doubt. Err on the side of caution. You can wear a medical emergency or a medical treatment alert bracelet. So just to let people know that you do have a severe allergic reaction, so that people know to be aware of that. So that is the most severe type of allergic reaction, anaphylaxis. Then there are, of course, less severe allergic reactions, and these symptoms can range from mild to moderate. And the symptoms will depend on the type of allergen, and it can be one symptom or it can be a few different symptoms. And again, it affects many organs. It affects the airways, it affects sinuses, nasal passages, skin, and the digestive system. So I suppose the most common one, hay fever, causes sneezing, itchy, runny nose, blocked nose, and sometimes itchy, red, and watery eyes. And then for insect bites especially, you can get wheezing, chest tightness, shortness of breath, cough. And sometimes this cough then can cause a bit of a, or sometimes if you have a runny nose as well, it can cause a bit of a postnasal drip when you lie down, and it can make you cough. Swollen lips, tongue, swollen eyes, and swollen face. Then with food, you can get tummy pain, vomiting, sickness, and diarrhea. And then with skin, it's a rash, so it's itchy, raised skin. It can be dry, it can be cracked, and some people can also get hives, which can be really, really itchy. It can be quite hard sometimes to distinguish with skin whether it is an allergic reaction or not. So sometimes if you're not sure, you can bring somebody, you or your child, to the local pharmacy, and generally to diagnose it, it will be a series of questions that will get us to the point as to whether it is an allergic reaction or not. The best thing with symptoms is to keep a diary to help you determine what is causing these symptoms. And when you are keeping a symptom diary, it's important to be as consistent and as disciplined as you can be, and to always do it. And also to be as detailed as you can. So you want to put the date, you want to put the time the symptoms occur, you want to put what you were doing at the time, and you want to put exactly what the symptoms were. So that's really, really important. And you can get lovely little like templates of symptom diaries online if you want to print it out so that you have it there. So that is just a bit about the symptoms of allergies, and now Megan is going to talk to us about how to diagnose allergies.
Perfect, thanks Rachel. So obviously the diagnosis is a core part of managing the allergies. By identifying them, you know what you're dealing with it, and it also helps with preventative measures. So as Rachel mentioned there, it's so important to self-monitor as well, because regardless of the tests that are done, the diagnostic tests, some of them are only so accurate, so largely it'll be linked into person's history. So like that symptoms, when they occur and how often, any triggers that might be suspected, that type of thing. And everything together can add up to help make the diagnosis. So the type of the test depends on a lot of different things. I guess the suspected allergen, the symptoms, condition of your skin, and any medication you might be on. So the first one we're going to dig into is a skin prick test or a scratch test. This is often kind of the first port of contact that's done, and this is can test for a wide variety of allergens. So basically what it is you get you can either do it on the forearm or the back, and a droplet containing a tiny amount of the allergen in question is placed on the skin, and then the skin is scratched with a special device. It's not actually a needle, it's just a plastic device that scratches the top part of the skin. So, and that's to see if there's a reaction, and a control is done with histamine so that you can show that your skin is reacting. And if you get a raised hive in connection with any of the drops, a few are done together, they're just spaced out. And if a hive comes up, that means that you're allergic to it. Now, this is pretty, it's a pretty good test, but it doesn't necessarily measure how allergic you are. So it's just that there is suspected there is some form of an allergic response happening. So it's deliberate exposure, but again, it's a small amount of the allergen, so it's relatively safe, and it's not particularly painful. You might get a bit of mild discomfort, but there will be some caution here if you have a history of a severe reaction. So your practitioner will be very mindful of that. The thing with the scratch test is you can't take antihistamines before it, and often for a week before it, because it interferes with the results. Obviously, if there's an antihistamine in the system, the reaction will be affected. So just remember to communicate clearly with your doctor what medications that you're taking. And this is just a good time to make this point in general. A lot of people would be on medications that they buy over the counter, including some antihistamines and various medications. It's important to communicate that to everybody, your doctor, your pharmacist, just so there's no interactions between different ones. So that's the scratch test. Then there's blood tests. So you might do one of these or you might do both of them. Again, particularly making a diagnosis, there can be false positives a lot. So again, that's why it's linked in with your history. Blood tests are a sample of blood removed and analyzed for specific antibodies produced by your immune system. So it can be useful if you're at risk of a severe reaction rather than exposure, and where a rare allergen is suspected. So there's some general blood tests that determine how much IgE is there. So it's just determining that there is an allergy. And then there's ones that can test for specific proteins that you might be allergic to. So again, it depends on who you're working with, your allergist, and what they want to test. So those are the two main ones. Then we have patch tests, which are useful for a specific type of eczema called contact dermatitis, where your skin will be actively exposed to an allergen. It'll be taped on with a non-allergic tape. And again, this is an important point with all these tests is including the liquid in the scratch test that the allergens dissolved in, or the tape, that they're non-allergic so that they don't cause a reaction themselves and give other skewed results. So for the patch test, a piece of something that you might be allergic to is applied to the skin for days. It often takes a couple of days to see this contact dermatitis, and the skin is examined usually day 3 or 4. So that is another one specific for the skin. So those can be used for a variety of ones. And then there's 2 more specific to food allergies. So before I get into these, I just want to mention that these aren't designed to be done at home on your own. They're very much designed to be done in conjunction with your doctor. And the challenge testing, as we'll look at, is actually done in a clinic. So the first one is the Elimination Diet. This is useful for food allergies. So basically what it is you avoid it for a number of weeks and see if the symptoms improve. And then after that number of weeks, you reintroduce it to see if there's any reaction. Now, this is obviously okay for certain types of allergies like dairy allergy, but if it's a severe allergy like a nut allergy, this wouldn't be safely used. And again, regardless of what allergy you're testing for, it would be strict supervision along those lines. So just not attempting to do it yourself at home is the main point that I want to make there. And keeping a food diary is obviously very important as well. So then we have challenge testing, and this can be riskier than other tests, but it's actually the gold standard. So it's the most accurate form of testing for a food allergy. And this is the one I mentioned is done in a clinic in a very safe, controlled environment. So basically, you're given the food that you suspect is causing the allergy in gradually increasing amounts to see how you react, essentially, under close supervision. So the risk with that is it can cause a severe reaction, and that's why it's done in the clinic where they have access to medications and different things, so there be a severe reaction. So it's a very accurate way of diagnosing a food allergy and determining some level of severity as well. So that's it. So we have scratch tests, blood tests, patch tests specifically for contact dermatitis, and then for food we have elimination diets and challenge testing done in close medical supervision. The last thing I want to mention is there are a lot of home testing kits floating around there that you can get online in different places, and they're not recommended by the HSE because the standardization isn't really, they're not always proven methods. And what can happen is you see a lot of people, they do these tests and they come out allergic to loads of things, and they might eliminate a lot of foods from their diet, and this can cause nutritional imbalances and different things like that. So just important to make sure that the test you're doing is accredited and done in line with a medical practitioner. So that is diagnostics, Rachel, and then we're going to go on to treatment.
Thank you, Megan. So I'll start with how to treat the most severe allergic reaction, which is anaphylaxis, and this is always treated with adrenaline. And when usually, if we know we're allergic, we are prescribed adrenaline pre-filled pens by your doctor, and then we will dispense it for you in the pharmacy. And the dose of the type of device that you are on will depend on the conversation that you have on your doctor, and usually it depends on your age, obviously. So children under 6 will be on the junior pen, and this is a 150 microgram dose pen, and then children over 6, between 6 and 12, are on a 300 microgram dose pen, and then adults are on, the correct adrenaline dose for adults is 500 to 600 micrograms. So that will be one Emerade pen. The Emerade comes in a 500 microgram pen, or 2 of the 300 microgram pens. So maybe 2 EpiPens. Now, some adults I have seen will be just on 1 300 microgram EpiPen because that is all they need, but it is you and your doctor that will decide that together. So the type of device that you are prescribed, so there are 4 different ones. There are Anapens, EpiPens, Jext, and Emerade, and they all are more or less the same, but they were slightly different. The way you use the device is slightly different. Most people will have one that they've used for life and they like to stick with that one. And if possible, I would recommend that because you're very familiar with how to use it. Unfortunately, I know from the pharmacy sometimes availability is a problem. So it might just depend on which ones are available as to what we can supply. The other thing that can sometimes be a problem is the dates. These pens can sometimes be quite short dated, and they're not actually that cheap. They're relatively expensive, especially if you don't have a medical card. So people like to get the longest dated ones, which is fair enough. So we will always ring the supplier and ask them. So sometimes that can depend on which device that we buy as well. I'm not going to go through how to use each one because they're all different. And the most important thing for you is to know which one to use, how to use the one that you have. And you can do that by actually, a lot of them have a lovely little pictogram at the side of the box, which is really, really easy to use. And then a lot of them come with instructional video on YouTube, so you can watch that. And I would say that it is very important for you, your child's carer, your child's teacher, whoever it is that's involved in their care, that they all know how to use this pen and to always check the date on the pen as well. And I suppose one thing that's common with all of the pens, it's an intramuscular injection. So it's into the muscle, it's into the outer upper thigh, and you hold it down for 10 seconds. And it is important to count out the 10 seconds to make sure you hold it down for a sufficient amount of time. And then you massage the area gently. Always put it when it's used, like that's a used needle, so always put it somewhere safe. You might not have a sharp spin with you, but put it somewhere where it is safe. And also when the ambulance men come, you want to show them exactly what it is you've administered so that they know. So it's important to have it at hand there as well. And then, as I mentioned, because up to 20% of the time, it's hard that they don't have an exact statistic for how often a biphasic reaction can occur, but it can be up to 20%. Always make sure that once you've used an EpiPen, get another one, have it on hand with you for at least another 2 days, just to make sure that you have it there if a biphasic reaction were to occur. Always replace it immediately. So that is how to treat anaphylaxis. Now we'll just go on to how to treat other type of more milder allergic reactions, which can often be treated over the counter or sometimes with some simple prescription medication. I would say that if you are coming into the pharmacy to get over the counter medication, always just check with your pharmacist that it is safe, especially if you are on other medication, if you have other medical conditions, or especially especially if you're pregnant or breastfeeding, or also if your child is very young. We would often have, because little babies sometimes can get skin reactions and hay fever, and a lot of the things that we would sell over the counter are only, say, from a certain age. 2 years old comes to mind, because a lot of the antihistamines, like say the Zyrtec solution, would only be from 2 years old. So just always check with the pharmacist if it's safe. So we'll start with the antihistamines for hay fever. I suppose that's the most common thing that we would see. So I just have, like, say, they would come as drowsy or non-drowsy often is the kind of the first question that we would ask. Do you want something that some people would find that it's at nighttime, that they need something to help them sleep? And then Periton can cause drowsiness. It doesn't in everybody. And then you have the non-drowsy ones, which are antihist. That's also the same as Zyrtec, the same as Cetrine, the same as Cetirizine. It comes in a few different brands. There's other ones as well, like Loratadine, and the other one is Claritin as well, that you get over the counter. The only drowsy one is the Periton. That's the only one that causes drowsiness. They can all cause some anticholinergic side effects, which are usually very mild and very well tolerated: dry mouth, dizziness, and sometimes a little bit of a headache. You can also get them in liquid form for children. The Zyrtec liquid can be got for kids as well, which is handy. In terms of which, there is no one that's more effective than the other, and they're supposed to be as effective as each other. What I would find from my experience from working as a pharmacist, and you probably found the same, Megan, is it's just purely anecdotal. Some people will say, this is one I've always found works for me and this one doesn't. And that's just, you know, the way it is for some people. And the other thing is, tolerance shouldn't be a problem. So it shouldn't be a thing that you, because you've always used that it's stopped working for you because you're desensitized to it. That shouldn't be a problem. But there have been, again, anecdotes that patients would have told us that when they switch up, that it can just be helpful for them. And that might be just a psychological thing, I don't know. But if you find an antihistamine that works for you, I would recommend to just stick with that when you need it. In terms of how long people should use antihistamines for, that kind of depends on your doctor. But for us in the pharmacy, if we give a 30-pack supply, we would say no longer than 30 days. After that, if you still need to be using an antihistamine, you should get it checked out by your doctor. And this is really because sometimes antihistamines can mask certain problems. So let's say if you are having a really runny, itchy nose, so you keep using your antihistamine and it's working and it's helping to resolve those symptoms, but there still could be a little problem in your nose. There could be some inflammation up there that needs to be treated. So if you are using your antihistamine for more than 30 days and you're coming in to get another box, I would be saying to you, I'd recommend you actually have a chat with your doctor. And sometimes there's just a better medication that you can get on prescription that will work a bit better for you as well, and that will get to the source better. So that is all about oral antihistamines. And oral antihistamines can be used for hay fever. It can also be used for when you get the itchy or dry or scratchy eyes, and it can also be used for skin. If you find that the cream's not working, or if the skin reaction is everywhere and you're not able to lather it all over your body, sometimes taking an oral antihistamine for a few days can just help bring the heat and the itchiness down. After that, I'm just going to move on to nasal sprays really quick. So for nasal sprays, the first one, if you find that you have a very stuffy nose and it's really blocked, and you can use a decongestant just to unblock it. Sudafed nasal congestant or the Atravine nasal congestant spray, and they unblock the nasal passages. They shouldn't be used for more than a week, and because if you use a decongestant, and that goes for an oral one as well, for more than a week, it can actually make it worse and cause rebound congestion. And it also should not be used for people with, it should be used with caution with people with high blood pressure. So just to be aware that it can actually bring the blood pressure up a little bit. The next nasal spray that I'd like to talk to, and I'm a big fan of these types, is the Saline Rinses. So you would say for children, you can get a lovely simple one, which is just the Calpol sinus. For adults, you can get something like the Sterimar. They come in loads of different types, some with a little bit of copper, some with a little bit of, I think, magnesium comes in another one. So there's a few different brands. And then if you want something even more sophisticated, you can get the Neilmed or the Netipot, which is a pure irrigation system if you need a deeper cleanse. And what's really good with allergies with these guys is that if there are irritants or bits of pollen or something that you're allergic to stuck in your nasal passages, it just clears it out, which is really, really good. And then the next one I'll go on to is steroid nasal sprays. So let's say if you have been using antihistamines, decongestants, and a saline rinse, and there's still nothing working, we might move on to a steroid nasal spray. Now, you can get these over the counter in the pharmacy. Again, we would say from us up to just 1 month, we would only recommend to be using these. After that, we would say to go to a doctor, because you can get different, stronger steroid nasal sprays on prescription. So we sell Nasocort, Flixinase and Beckinase over the counter. And what they do is they reduce the inflammation in the nasal passages. So they reduce the inflammation in the nose. If you do speak to your GP, some people actually use the steroid nasal sprays all summer. They can use it for 3 months of the summer, and it just really keeps your hay fever under very good control. A lot of people would have a treatment plan in place where they might start to use their steroid nasal spray 2 weeks before their hay fever season begins, so that it starts to work, because it can take a few days to work, and then they just don't experience any of the nasal symptoms at all during the hay fever season. And the other thing is, sometimes if people are on it for a long period of time, be it 2 or 3 months, some doctors recommend to reduce it gradually at the end, because some of the doses might be 1 spray twice a day. They might say to go down to 1 spray a day for a couple of weeks before you stop it all of a sudden. But you can just have that conversation with your doctor. And then another simple method to this is kind of a prevention or treatment really, is the Vaseline in the nose, and it does work quite well if you put a little coat, especially for people like pregnant women or breastfeeding women who can't take any anti-allergy medication. You can put a little layer of Vaseline in the nose, or there's a nasal spray called Preferable in Allergy, which is suitable for pregnancy and breastfeeding, and it just forms a barrier in the nose to literally physically stop the pollen from going in. Just a little simple tip then for using nasal sprays. I always like to blow my nose just before I put it in, so that it's nice and clear for penetration. And then try not to blow your nose for 15 minutes after using it, because you don't want to just blow all the medication straight back out of your nose. So that's just a little tip. Leave about maybe, if you could, 10 minutes, I would say, if you're using a few different nasal sprays, like let's say you're using a saline rinse and a steroid nasal spray, use the saline rinse first, give it about 10 minutes, and then administer the steroid nasal spray or whatever other nasal spray you're using. So that's everything that I have to say about nasal sprays. Then the other thing I'm going to just talk about quickly are the eye drops. I actually forgot to grab them from the pharmacy, but there's only 2 types that you can get really over the counter, and they are Octacrom and Atravine eye drops, which are the only anti-allergy eye drops that we would sell over the counter. So the Octacrom, you just have an antihistamine, sodium chromoglycate in that one. In the Atravine, you have an antihistamine and a vasoconstrictor. So if you had really red eyes and it was just a cosmetic problem for you, maybe you have a wedding or something to go to and you don't like having red eyes, I would say to go for the Atravine, because that has the anti-redness agent in it. So they're the 2 types of eye drops. I would also say, if you also suffer from other eye conditions, maybe dry eye, keep using your dry eye medication, because your eyes won't heal from the allergies if they're not moist and if they're too dry. So that will be really important as well. And again, leave a little gap. If you're using a few different eye drops, leave a little gap between them. Now, if you are on other eye drop medication, like maybe for glaucoma or prescription eye medication, do check with your pharmacist that it's okay for you to use Atravine or Octacrom on top of that, just to make sure. Also, just a little tip for using eye drops. So you pull down your eye like that, and you're dropping the eye drop just in here in the little pocket there. And then you should close your eyes gently for about 2 minutes after administering the eye drops, to make sure that it, forms a lovely coat over your eye and is penetrated in. And another little tip is, if you don't want any systemic absorption to occur, so sometimes the eye drops can go down into your throat or nasal passages while you're closing your eye for that 2 or 3 minutes. If you just gently put a little bit of pressure there into the corner of your eye, that will stop any, it will prevent as much anyway, systemic absorption occurring. So that is everything about our eye drops. Then I'm just going to quickly mention skin allergies. So the first thing I would say is that if your child or if yourself has an allergic reaction with your skin, it's really important to keep your skin moist. So if you're using a moisturizer, to keep using that moisturizer, because dry, cracked skin won't heal as well from an allergic reaction. The things that I love to give over the counter for skin that's experienced some kind of allergic reaction are moisturizers that have substances or ingredients in it that help with an allergic reaction. So one thing that comes to mind is something like the Aveeno skin relief that has a little bit of menthol in it, which helps to cool down the skin. And it doesn't really matter how much of that you use, you can put a lovely good coat on it because it's all very natural materials that you're using, and you're getting the benefits of the cooling, soothing of the menthol. And also Aveeno is a moisturizer, so you're getting the benefit of hydrating the skin at the same time. So, and that's a lovely product. Calamine lotion is lovely for children or for adults as well. It's just a lovely natural cooling lotion. And then another one is one that I love and that's very popular is the La Roche-Posay Lipikar AP+. So that's La Roche-Posay Lipikar, Lipikar AP+. It comes in a lovely big kind of like a drum. And again, it's a soothing moisturizer with anti-scratch, anti-itch properties, and it's supposed to rebalance the microbe of the skin. It's really, really good. A lot of parents of children that have really allergic prone skin really rate it very, very highly. And again, you can put as much on as you can because it's just really good for your skin. So that is our moisturizers. Then if you want to go, say if you have specific little patches of a skin, especially if maybe you have got a nettle sting or a bee sting or something like that, you can go with an antihistamine cream. So something like this, the Urax cream, or there's an antihist cream as well. And you can, again, keep using your moisturizer and you can just put that on twice a day, just on literally directly onto the little bits of allergic reaction on your skin, the little red bits. And then I will, suppose very cautiously mention a steroid cream. So we do sell one steroid cream over the counter. And look, there's a place for everything. There really is. This is the 1% Hydrocortisone Cream. It's not for the face and it's not for children under 12 for over-the-counter use. But if you did have someone that just got a really, really bad reaction and there was just a small area of the skin that was very red and very itchy and just needed to, if we saw a bit of inflammation that we needed to get down quickly, a steroid cream would be appropriate. You only need a small bit and it wouldn't be good for very damaged or very dry or very broken skin because it actually thins the skin. So that is also available over the counter, but you can get steroid creams on prescription, and you can actually get creams that are kind of a diluted version of a steroid cream, which is good if you have large areas to put the cream on, because then you're just not getting loads of the strong steroid cream, you're getting a diluted version of the steroid cream that can go all over a large area. So that is everything about creams. And then I'm just going to finish by mentioning something. This is kind of outside of our realm because it's very much something that would be discussed with an allergic reaction consultant or an immunologist or something, and that is immunotherapy. So we would dispense these on prescription to a few patients, and basically what immunotherapy does, it reduces your allergicness, so to speak, of a particular allergen. So you basically take what you're allergic to in a modified form, so it weakens your body's response to that substance and that's causing the allergy, and allows your immune system to kind of be desensitized to the allergen. So this is something that is initiated by a consultant that would specialize in immunology and allergic diseases. So that is just a little mention of that there. So if you have a child that has maybe suffered for years with something and it's really affecting their quality of life, and you've used all of the prescription medication and OTC medication that there is, and you need another option, it is something to discuss with your GP, and they might recommend a referral. So that is everything about treating allergies. And now Megan is going to talk to us about how to prevent allergies.
Perfect, thanks Rachel. So yeah, so we looked at diagnosing the allergy, so you know what you're dealing with, which is so important, and we've just gone through all the medical treatments. So we're going to look at prevention, and these are a lot of non-medical options, more practical things to avoid exposure. Now, obviously, that's not always easy or practical, but if it's a severe allergy, it's vital. If it's a mild allergy, you know, you just do as much as you can to prevent the exposure and enhance the quality of life really overall. So it very much depends on what the allergen is. So I'm going to go down through a few different allergens and some practical tips on how to avoid exposure. So we're going to start with dust mites. It's a very common one. There's a different variety of dust mites, and they're tiny insects that live in household dust, and they especially love soft furnishings, carpets, curtains, couches, that type of thing. So if you're trying to reduce the house mites in your home, I would advise as well to focus on areas where people spend a lot of time, like bedrooms, living rooms, that type of thing. So some things that you can do, again, it revolves around minimalizing the soft furnishings that are available and keeping them clean. So the first one is that wood and hard vinyl floors are preferable over carpet. Now, obviously, you know, it mightn't be practical to go tearing out all the carpet in your house. There is actually some options for getting carpets cleaned, and there are some options for specific anti-dust mite treatments. And again, I would just check it with the people that provide those services, because you want to get a non-toxic one, especially if you have pets or children. Just be aware of that. So curtains, if you have curtains, to wash them regularly, or roller blinds are great because they can be wiped down, wiped clean. In terms of furniture, leather, plastic or vinyl furniture is preferable to upholstery. Cleaning cushions, soft toys regularly. So soft toys are a big culprit, especially for kids, because they can harbor dust mites. But obviously, you know, if they're sentimental, again, not to get rid of everything, but just to manage it. So for soft toys and for soft furnishings like cushions, pillows, one of the best treatment methods is to wash them. And a step up from that is to, first of all, put them in the freezer for 24 hours and then wash them. So that kills the dust mites, and then you wash them out just to make sure that they're definitely gone. So that is an option. And again, just check the washing instructions that it doesn't dissolve because you want to get high temperatures, like preferably 55, 60 degrees if you can. So for a bigger piece of furniture that might be upholstered, you can try hoovering them to try and take out as much of the dust mite as you can. Regularly cleaning surfaces with a damp, clean cloth, and again, to avoid dry dusting, because you can actually just spread the allergens, the dust mites, into the environment and then breathe them in. So those are just some things on dust mites. And dust mite allergy. Dust mites are very common in general, and the allergy is quite common, and it can really affect people's quality of life. So it is worthwhile kind of gradually transitioning to a very kind of hypoallergenic environment if you have a serious allergy. And again, it can be done over time. So next we're going to look at hay fever. So some doctors refer to this as allergic rhinitis. So rhinitis is just inflammation of the nasal passageways, and it's caused by an allergy in this case versus other things like viral rhinitis. So this is really a response, an allergic immune response to pollen. So there's a lot of different plants that produce pollen, from grasses, trees, that type of thing, and different species pollinate at different times of the year. So you can have, you can experience allergic symptoms at a range of times. So it's usually in the summer, but where the grass pollens are highest, but tree pollens pollinate kind of before and after summer. So you could experience symptoms at different times depending on which one affects you. So yeah, once you kind of figure out which one it is, then it can be helpful to apply these tips. So checking the pollen count on a daily basis when you're in the season that you know the pollen that you're allergic to is highest. And then in these days, just to be mindful of the following. So keeping the windows and doors closed, especially when the pollen counts are highest, and also early in the morning and early in the evening. So the pollen actually rises in the air in the morning and falls in the evening. So that's why there can be a lot of it around at those times. Different things like wraparound sunglasses can prevent them from the pollen from getting off, touching off the eyes and causing eye itching and watering, that type of thing. Cleaning, again, with a damp cloth or microfiber cloth regularly, just to get the pollen off the surfaces. Washing bed linen regularly, and pollen is particularly, like, it's sticky, it sticks to hair and clothes very easily. So if you're outside all day, they recommend coming in, showering and changing your clothes. This is especially important for people with long hair. It can really attach to hair, and they say one of the biggest issues for allergic rhinitis is that people, they're outside all day, the pollen is all in the hair, and then they go to sleep and it transfers onto the pillow, and you're basically lying in it. Your face is lying in this kind of pillow of pollen essentially. So it's important to keep the hair clean regularly, and this can be a bit of a nuisance, but in the summer, you know, or you can shorten the hair for the summer season. And to wash the pillowcases specifically very regularly. They recommend washing all the bed linens weekly, but the pillowcases I would do, you know, daily or second daily if you can, just to again prevent, reduce the symptoms really. Other things like avoiding very grassy areas, parks and fields as much as possible. Houseplants are another contributor to pollen in the environment, especially flowers and things like that. So keeping them outside when they're pollinating. And if you have a lawn and you're very allergic to grass pollen, to maybe ask a friendly neighbor to mow that for you so that you're not exposed to like a big stir up of pollen. So that's hay fever specifically. Another similar, on a similar trend, insect bites. Some people are severely allergic to insect bites, and again, some people do carry EpiPens for this. reaction. So minimizing the risk is what you can do, covering exposed skin, wearing shoes, avoiding kind of strong smelling perfumes or creams and things that can actually attract insects, especially for wasps and bees, to keep food and especially sugary foods covered so that it's not drawing them into the environment. So next we're going to look at mold spores. So molds, when they grow, they release tiny particles into the air. They're invisible to the naked eye, but they can be plentiful and they can cause allergic reactions. And I guess the main two things are to remove the source of the mold and also manage the environment, because they love humidity. So moisture really helps them to thrive. So this is especially important for people who are allergic, but I would say for everybody, you know, to note these points, because that mold spores aren't really good for everybody, and we've very damp climate in Ireland, so you can often see dampness in houses and mold growing. So keeping the environment dry, well ventilated, that can help prevent them from growing and thriving. Indoor pot plants can be mold can grow on them and then the soil around them. Checking the house and environment regularly for signs of dampness around windows, door frames, that type of thing, and addressing it kind of promptly if you can before it starts to cause problems. Clothes, they say to be very careful about clothes and storing them in damp areas, or packing a wardrobe too tightly that the air isn't circulating, and mold can kind of can grow on the clothes as well. Outdoors then, just to keep the lawns free from fallen leaves, they're a great one for harboring mold. And composting, while that is very good and very good for the environment, just to keep the composter away from the house so that the fungi isn't kind of getting into the environment. And they also recommend a closed type of composter for people if you are very allergic. Then in terms of the house, things like cooking and showering can create a lot of humidity, and just to kind of keep internal doors closed while you're doing those activities, just to prevent the spread of it through the house, especially to areas where there's soft furnishings. And extractor fans and air conditioning systems can be helpful with that as well. So that is mold spores. And again, like I said, you know, regardless of allergy status, I would just keep mindful of that. It's just not great for the lungs as well to be breathing in these spores. So just to be vigilant for those. Pets then, so this can be a challenge for people with pets. It's not actually the pet fur that causes the allergy, it's the skin flakes, saliva, that type of thing, the dander. It can be tricky, especially, like I said, if you have a pet and they're part of the family and you've discovered halfway, you know, through keeping this pet that you have an allergy. So it's easier if you're considering getting a pet. Again, if there's any allergies in the house, to be mindful. There are some, as Rachel has made me aware, some hypoallergenic dogs. Rachel, you have one of those dogs, don't you?
Yeah, we have a cockapoo, so he's a cross between a Cocker Spaniel and a poodle, and he is hypoallergenic. And I have two sisters that are completely atopic. They have eczema, they have asthma, and they have hay fever. And he has not caused any problems whatsoever. He is really, really great. He's non-shedding, which is brilliant. I know a lot of people, those dogs are often bred, and a lot of people are very keen to get rescue dogs, which I completely understand. But I suppose it's a great option to know if you want a pet, that those cockapoos, labradoodles, and hypoallergenic dogs are genuinely hypoallergenic. They don't cause any of the allergic symptoms. So it's just a point to note.
Tried and tested by your family. And again, yeah, and look, especially like if you have kids, they're going to want to play with the dog or the animal. So it's just, yeah, to try and come up with an option. And before getting an animal, I'd suggest, you know, that they spend some time in, just because sometimes you mightn't realize if they've never had a dog or been in contact with a dog, you might notice that they have an allergy. So just be mindful of that, obviously, safely. So other things with pets, like if you have a pet and you found out that you're allergic to it, so just these are things to kind of minimize the allergic reaction and the extent of it. Keeping them outside as much as possible, or in a certain area of the house, particularly a non-carpeted area, so that it doesn't the dander and stuff doesn't kind of accumulate. Not allowing pets in the bedrooms or really up on soft furnishing as much as possible, and washing them regularly and grooming them particularly outside, so that you're not again introducing these allergens into the air and the environment. Ventilation is good, and again, if you don't have a dog but maybe your friend has a dog, or you're going to be around animals that you're allergic to, you can take an antihistamine if that's suitable for you about an hour before, just to prevent an immune response should you're going to be in contact with them. So that is animals. And then the last one I'm going to look at is food allergies. So again, like I mentioned, some food allergies are extremely severe, and you know, prevention is absolutely vital. So it just has to be completely avoided at all costs, really. So again, I would link in with your healthcare practitioner before you're going to be eliminating foods for a long time, because just to be mindful of nutritional imbalances. So preventing severe allergies, obviously if you have a severe nut allergy, again, adrenaline pen to carry to them with you, as Rachel mentioned, and clear communication between colleagues, teachers, friends, everything, so everybody's aware, because like Rachel mentioned, it is life-threatening. So to first of all avoid the allergen, but second of all to have a treatment option to hand and that everybody's aware of, so that should there be an emergency, that there's some kind of confusion as to what is going on really. So it's so important to be reading labels. Legally, food manufacturers have to put certain allergens on the food. This is great for obviously packaged products, but it can be a problem for foods that aren't packaged, or things in bakeries and things. So people with food allergies, they most often experience allergic reactions while eating at restaurants. And again, because there's a lot of different ingredients and there can be cross-contamination in that. So there's a few tips here to avoid that. The first one is not relying on the menu description alone. So I know a lot of menus do have the allergens on there, but to definitely not rely on that, because there could be sauces on the side or dressings that have allergens, and to actually communicate it with the waiting staff and ask them to communicate that with the kitchen. And I've worked in a lot of different restaurants before. It is just part of it, and you know, they'll be able to advise you on the best dishes to select, and they'll also be able to advise you if they can't guarantee that the food that you're allergic to is in the food. And then that's, you know, it's better, if you're not sure about it, don't risk it. So again, when you're communicating your allergy, I would communicate the severity as well, because sometimes it could just be a mild allergy, or it could be like life-threatening. So you want to make sure that they're on the same level of risk as you are. Avoiding places there's a lot of cross-contamination, buffets and bakeries, really, you know, there can be a lot of different ingredients in the same space, and they can be mixed in. And always checking the allergens in a dish, even if you've eaten it before. So people, they mix up their recipes, might have eaten a pizza before and say, okay, this one I'm okay with, but just to check it every time, really. And again, it's just about making it a system rather than seeing it as an inconvenience, just to make it part of the process. So that's the thing. Again, with nutritional imbalances, like things like peanuts and eggs can be removed without really any issues, because while they're a good source of protein, a lot of people don't eat them, and there's no, you know, you can get protein from a lot of other sources. The issues with nutrition imbalances come into play, particularly with things like milk and dairy allergies, because it's also a very good source of calcium. And again, that's by working with your doctor or a nutritionist or a dietitian, you can offset this with maybe incorporating more dark leafy greens, that type of thing, to make sure that you have the right levels of calcium. So going back to reading labels, again, there's a lot to this, and that you can do a lot of research on this. And again, looking for what to look for, essentially, you know, may contain or may contain traces of. And again, depending on the severity, traces of can be just as dangerous as, like, you know, there being a main ingredient. So just be mindful of that. They say as well to be careful if the product says it is vegan. You know, obviously that would be no animal products, but if you have a dairy allergy and things, they can actually, it's a very broad definition, vegan, when it's on food products. So just to check for your specific allergen, and to familiarize yourself with the term. So for example, sesame, if you have a sesame allergy, it'd be in tahini paste and different things like that. So there's a lot of different words that could be used for the same food component. The same with peanuts, like it can also be called arachis oil. And to be aware of foods, but also non-food products. I know we've seen arachis oil in a lot of things, actually in labs and pharmacy at one point. I think there was an experiment, Rachel, with arachis oil, and that's actually peanut oil. So just to be vigilant of the different terminology that can be used. Other non-food products that contain allergy-causing foods, even soaps, shampoos, they have like soy, egg, tree nut oil in it. We have a friend, actually, a colleague pharmacist as well, who's a nut allergy, and there's a lot of makeups that have almond oil and different things. So my awareness even on that has enhanced, whereas it'll be in things that you might even realize. A lot of different products like that. Glues and adhesives on envelopes actually have traces of wheat. So again, depending on the allergy there. And yeah, so just becoming vigilant, and any new products coming into the house, just to check what's actually in them. So I guess the main thing for prevention, particularly in food allergies, and particularly when it's severe, is notifying the people around that person, especially if it's your child. So the teachers are aware, if they're old enough that they're aware, their friends maybe are aware, and if the child is educated as well, especially when they're able to understand everything that's going on, and they can be taught when they're a certain age to be vigilant of food labels and different things like that, and how to manage an allergy and how to communicate that with people around them. I think that that's really the main thing, is good communication and education. So that is really what I have to say on prevention. Again, there's so much we could talk about. Let's just try to get an overview of all the main allergies and preventing them.
Yeah, definitely. So that's everything that we have to say today about allergies. If there's something that we missed that you would have liked to have heard about or anything, or if you have any questions or queries, we have an email address. It is pharmacistsdispensingIdeas@gmail.com. So that's pharmacistsdispensingIdeas@gmail.com. So feel free to contact us. We hope you got at least 1 or 2 good ideas on how to treat and manage and prevent allergies in time for the allergy season before it comes up. So thank you very much.
Thanks for listening, everybody.